Jaundice. Jaundice means a yellow discoloration of the skin and sclera. Jaundice detected clinically in the sclera of the eye and mucous membrane of the mouth and the skin. Normal total serum bilirubin is 0.2 to 0.8 milligram per deciliter of blood. Clinically, the jaundice detected when the serum bilirubin level is up to 2.5 milligram per deciliter. إذن الجوندس راح يبين عندنا المريض clinically إذا كان level of the total serum bilirubin above 2.5 milligram. طبعا راح نشوفه بالسكليرا وميوكس ممبرين of the mouth، وإذا كان التيز بكلش عالي يبين بالسكن. طبعا الكلر اوف ذا جوندس هو طبعا معروف هو اصفر، بس هذا الاصفر بدرجات، اكو شكله مثل الاورنج وقسم مثل الليمون وقسم من الليمون تو اورنج. عادة الليمون تو اورنج يصير بالبيلري ستونز، يعني بالبناين كيسز يكون لون الجوندس من ليمون الى اورنج. Well, in the obstruction due to malignant causes or progressive jaundice يكون لون الجوندس لونه برتقالي orange in color. طبعا هذا هو rough estimation for the cause of the jaundice، انه من الكلر ممكن بعض الاحيان يصير عنده فد idea about the cause of the jaundice. Jaundice can be classified into three types according to the pathophysiology of the jaundice. Either hepatocellular jaundice, hemolytic jaundice or obstructive jaundice. طبعا الobstructive jaundice نسميه ايضا surgical jaundice اللي هو يخصنا احنا كجراح. Okay. The hepatocellular jaundice, usually the cause of the jaundice due to liver damage by inflammatory process, and the agent could be a virus. And those with hepatitis A or hepatitis B or hepatitis C may develop jaundice due to hepatocellular damage to the hepatic cell and release of the bilirubin. طبعا both bilirubin direct and indirect, يعني conjugated and unconjugated may be increased. While the hemolytic jaundice means there is hemolysis, excess hemolysis of the RBCs due to hemolytic process like congenital one, مثل spherocytosis or sickle cell anemia or thalassemia. This lead to excess unconjugated bilirubin in the blood, lead to jaundice. While the obstructive jaundice due to something obstructing the biliary tree, either extrahepatic or intrahepatic. Okay. Surgical jaundice. It is a jaundice that develops due to biliary obstruction, partial or complete or intermittent. طبعا البارشال ممكن يبدي بالكوز ممكن يكون CA بعدين يصير complete progressively increased with time, the obstruction will be completed, or the intermittent one due to a stone that sometimes obstruct the lumen of the biliary tube, sometimes not obstructed. That's why the jaundice will be intermittent. Then a jaundice that progressively increase or deepen with time، يعني اللون يتغير ويصير more deepen من الليمون إلى الأورنج، معناها this is a progressive jaundice and the cause is malignant one، لأن الobstruction كان بالبداية partial صار complete. While the jaundice that sometimes deepen sometimes لا بيصير mild jaundice. This means the cause is a benign cause and usually a stone. طبعا in obstructive jaundice the bilirubin will be conjugated bilirubin. We know we have two types of bilirubin, conjugated and unconjugated. Conjugated bilirubin, under effect of the glucuronide transferase enzyme, the bilirubin will be a water-soluble bilirubin and can be secreted by the urine. The unconjugated bilirubin is not water-soluble bilirubin, and usually if you have excess destruction of the RBC, excess bilirubin formation, this lead to unconjugated hyperbilirubinemia. Causes of the obstructive jaundice or the surgical jaundice. Maybe biliary atresia, extrahepatic biliary atresia that occur in the neonate and infant and children, and usually in most of the cases it's not corrected surgically, while only in 10% it can be surgically correctable, and the patient at the time of the birth may not be jaundice, later on at the end of the first week the jaundice will appear, or sometime in 1/3 of the cases the jaundice start in the first day of life. There will be inflammatory process within the biliary caniculi for unknown cause. The exact cause of the biliary atresia is not known. Then the patient, if not treated, lead to biliary cirrhosis and death. Choledochal cyst مثل ما حكينا بالمحاضرات السابقة. Choledochal cyst congenital abnormal dilatation of the biliary tree of the common bile duct, could be extrahepatic, intrahepatic, or within the pancreas. And the patient present with abdominal mass, with fever or regular jaundice, cholangitis, and the treatment should be surgically treated because it is a precursor for the cholangiocarcinoma. Common bile duct stones, they can either primary or secondary. Either the stones developed in the biliary tree and the common bile duct due to abnormality in the pathophysiology of the biliary tree, مثل biliary dyskinesia, or stricture, or parasite, or the stone come from the gallbladder through the cystic duct and reach to the common bile duct. This is a secondary one. Ascending cholangitis, either due to stones within the common bile duct, ascending cholangitis developed, or a parasite within the common bile duct, or a foreign body within the common bile duct. Parasite scars or cholinergic sinuses, and the instrument may be, the foreign body may be also a stent putting within the common bile duct. خلينا احنا stent يعني عبار, and this lead to cholangitis, or we perform for the patient ERCP. So in ERCP we inject contrast media through the ampulla of water to the common bile duct, lead to cholangitis. Or the cause of the biliary of the obstructive jaundice is the biliary strictures. Biliary strictures may be iatrogenic due to trauma to the common bile duct during laparoscopic surgery, laparoscopic cholecystectomy, or any other trauma from the outside, مثلا stab wound or bullet injury, or stricture may be malignant stricture due to cholangiocarcinoma. The other cause, sclerosing cholangitis. This is also inflammatory process within the biliary tree. The patient present with jaundice, with itching, and the causative factor for the sclerosing cholangitis is sometimes idiopathic and sometimes due to injection of the scolicidal agent in treatment of the hydatid cyst surgery. During the hydatid cyst surgery, if you inject special type of the scolicidal agent اللي هي طبعا السكوليسايدال agent المواد اللي نستخدمها حتى نقتل السكوليكس, the head of the future hydatid cyst. بنسوي aspiration for the hydatid fluid بالعملية مالت الhydatid cyst. we inject scolicidal agent. هاي المادة بنحقنها بالداخل الكيس. إذا أكو biliary cysto-biliary communication, this contrast or this this substance will go through the cyst to the biliary tree leading to sclerosing cholangitis. طبعا the drug اللي حاليا forbidden ما نستخدمها as scolicidal agent هو الفورمالدهايد, الفورمالين. قبل formalin 10% use as scolicidal agent, and this is responsible for, this was the causative factor for sclerosing cholangitis. Cholangiocarcinoma هو عبارة عن tumor of the lower end or the common bile duct or the biliary tree. ممكن يكون بالlower end of the common bile duct هو common side, or could be in the confluent of the common hepatic duct اللي يسموه Klatskin tumor. Klatskin tumor هو carcinoma of the confluent of the common hepatic duct, and the patient also present with jaundice, obstructive jaundice. بنسوي له ultrasound نشوف الcommon bile duct ما بيشي, not dilated, because the obstruction is above the common bile duct, at the beginning of the common bile duct, at the confluent of the common hepatic duct. That's why the common bile duct will be normal. Or the cause of the jaundice, extrinsic compression of common bile duct by lymph node or tumor from outside, or a cyst مثلا hydatid, so a compression, extrinsic compression for the common bile duct, or a lymph node of blood due to مثلا lymphoma or any inflammatory process lead to compress the common bile duct leading to jaundice. Or the cause of the obstructive jaundice is parasitic infestation like ascariasis or entropy or cholinergic sinuses. These are ascend through the ampulla of water to the common bile duct, lead to stasis and lead to jaundice and lead to obstruction of the biliary tree. مثل ما تلاحظون بهاي الصورة, these are the causes of the obstructive jaundice. Surgical jaundice, obstructive jaundice. الcauses ممكن يكون طبعا هذا الليفر هنا واضح الليفر. ممكن يكون تيومر بالكومبلمنت هنا، الكومبلمنت هذا التيومر كاتسكن تيومر and complement of the common hepatic duct. ممكن يكون lymph node of the blood مثل ما مأشر هنا. ممكن يكون common bile duct stone. ممكن يكون round worm scars. ممكن يكون carcinoma of the head of the pancreas, carcinoma of the head of the pancreas, periampullary carcinoma, or chronic pancreatitis, chronic inflammatory process within pancreas lead to obstruction to the common bile duct or stricture to it lead to obstructive jaundice. These are the cause of the obstructive or surgical jaundice. Clinically طبعا jaundice مثل ما قلنا appear when the sclera and the mucous membrane of the mouth when the level of the serum bilirubin of above 2.5 milligram. Could be progressive, could be intermittent. قلنا the progressive معناها jaundice increase in depth and deepening with time. يعني خلال 3-4 أيام or the end of the first or second week jaundice is orange like jaundice color malt. This could be due to malignant cause مثلا structure بالlower end of the common bile duct. هذا structure تحول إلى complete obstruction صار الجوندس كلش deep. While intermittent jaundice معناها stone look like a valve يسوي مثل valve على lower end of the common bile duct. مرة يسده مرة لا، فلهذا الجوندس يكون intermittent. عادة يكون lemon color. تلاحظون هنا شلون نسوي examination for the jaundice. نقول المريض باعوا عليه فوق ونرفع الايلت راح نشوف الجوندس بالسكليرا اوف ذا اي. طبعا نستخدم السكليرا لانه وايت ان كلر، وعادة نستخدم نسوي كلينيكال اكزامينيشن فور جوندس لازم بالديم لايت يعني ضوء الشمس، ما نستخدم اللايت الموجود داخل الغرفة. The other presentation of the obstructive jaundice هو pruritus. pruritus يكون عادة بالباك and forearm. The cause of the pruritus هو deposition of the bile salt and histamine release. Bile salt deposit in the skin lead to reaction and histamine release lead to itching. Fever may be or may not present. Fever with rigor, with jaundice, maybe, and pain. These are the triad we call it the charcoal triad, which is the presentation of the stone in the common bile duct. Loss of the weight طبعا هذا يصير أكثر شيء with malignancy with cholangiocarcinoma or tumor of the head of the pancreas. Loss of the appetite also may be presentation of tumor, malignant cause for the jaundice. Pain in the right hypochondrium, palpable gallbladder. This may be due to stone in the lower end of the common bile duct. With the stone in the cystic duct lead to mucocele with obstructive jaundice. Carver's law may suggest inflammatory or neoplastic cause. What do you mean by Carver's law? Carver's law هذا قانون قديم يعني قبل 150 سنة كان يستخدموه الأطباء، كان جراح فرنسي استخدمه to differentiate between the malignant and benign cause for the jaundice. مثل ما قلنا ال color of the jaundice sometimes can differentiate between the benign roughly can differentiate between the benign and malignant cause for the jaundice. قلنا lemon to orange ممكن يكون benign يعني ممكن يكون stone cause، بينما orange deep orange ممكن يكون malignant. Intermittent jaundice usually the cause is benign يعني stone while progressive jaundice usually malignant. هنا أيضا إذا عندنا jaundice والpalpable gallbladder سابقا كانوا يعتبروه case of tumor. طبعا شنو معنى palpable gallbladder؟ معناه obstruction بالlower end of the common bile duct by the tumor والgallbladder كل شيء ماضي. It's not chronically inflamed. That's why the gallbladder will be distended with the bile. فإذا أي مريض عنده palpable gallbladder وعنده jaundice كانوا يعتبروه، وما عنده gallstone معناه يعتبروه هذا case of carcinoma of the head of the pancreas or cholangiocarcinoma. Any patient with jaundice و gallbladder not palpable معناه this cause is benign is stone، لأن إيش راح يصير؟ stone موجود بالlower end of the common bile duct راح يسوي لك jaundice. The gallbladder itself is chronically inflamed due to stones، لأن عادة الstone is secondary one from the gallbladder pass to the common bile duct. فالgallbladder is not distended، فلهذا يقولون patient with not distended gallbladder not palpable gallbladder وعنده jaundice the cause of the jaundice is benign usually stone. طبعا حاليا ما نستخدم هذا لأن احنا عندنا حاليا أكثر من way to diagnose the surgical jaundice عندنا سونر وعندنا سي تي وعندنا ام ار سي بي وعندنا ار سي بي ما نحتاج نعتمد على الكورفوزرز لو. شاركوترايات مثل ما قلنا ممكن يكون presentation of the obstructive jaundice due to stones اللي هو cholangitis. steatorrhea طبعا يعني عندنا obstructive jaundice for a long time, bile will not be in the inside the intestine and the duodenum and the intestine. That's why there will be malabsorption and there will be there will be disturbed absorption of the fat soluble vitamins like the vitamin D, vitamin A and vitamin K and lead to steatorrhea. مثل ما تعرفون steatorrhea هو passage of the offensive greasy floating feces and the patient losing weight طبعا. This we call it steatorrhea and due to malabsorption. What investigation we send for patients with obstructive jaundice? Liver function tests. There will be increase in the level of the total cellular bilirubin. The direct one will be increased. The conjugated one will be increased. Direct total cellular bilirubin, direct conjugated total serum bilirubin will be increased, and the alkaline phosphatase also will be increased. Ultrasound طبعا to visualize the biliary tree ممكن يكون مثل الكوز ممكن يكون stone ممكن يكون tumor. CT scan إذا كان tumor of the head of the pancreas لأنه البنكرياس retroperitoneal structure هنا CT scan very vital test for the diagnosis of the tumor of the head of the pancreas. MRCP حكينا عن MRCP, PT حكينا عن ERCP. These are the way to diagnose, to investigate a patient with obstructive jaundice. How you prepare patient with obstructive jaundice for surgery? طبعا السيرجري for obstructive jaundice حاليا عدد العمليات اللي بتجرى للأوبستراكتيف جونز قلت كثير لأنه الار سي بي معظم cause of the jaundice obstructive jaundice can be treated by RCP. يعني stone بالكمال بعدها can be treated by RCP. stenosis can be dilated by RCP. حتى إذا عندنا cholangiocarcinoma ممكن نخلي stent إذا المريض inoperable يعني ما نقدر نسوي له عملية، المريض تعبان أو التيومر locally invasive هنا راح نخلي ستنت وهاي ذاتس انف. فاذا عمليات قبل كنا نسوي عمليات للاوبستراكتيف جونز كل شويه، هسه حاليا قليل نسوي عمليات for the obstructive jaundice mainly the treatments by RCP. اذا first of all we should do proper diagnosis and assess the patient. We inject vitamin K مثل ما قلنا the obstructive jaundice due to stone for 5 days because the patient with obstructive jaundice have vitamin K deficiency and باعتبار الفيتامين K هو factor 7 important for the coagulation cascade فإذا يصير عندهم prothrombin time prolonged due to deficiency of vitamin K فلهذا لازم نعطيهم vitamin K to prevent any blood secretion any bleeding during surgery. بعض الأحيان نعطيهم fresh frozen plasma إذا كانوا أنيميا أيضا نحتاج نعطيهم blood، نعطيهم good hydration good support for the liver and mannitol مثل ما قلنا 100 to 200 cc of mannitol 12 hourly. antibiotic مثل third generation cephalosporin. treatment of the jaundice of the surgical jaundice if you have common biotic stone مثل ما قلنا ERCP stone removal or cholecystectomy either by open or by lab or transvaginal spectroplasty by open method or cholecystectomy or cholecystectomy يعني bypass for the side of the stone إذا كان common bile dilated more than 2.5 centimeter. إذا common bile is widely dilated we should do bypass to prevent recurrence of the stone later on. carcinoma of the head of the pancreas نسوي لهم either Whipple operation إذا كان tumor less than 4 centimeter and the superior mesenteric vein is not involved by the tumor we can do Whipple which is a radical resection for the tumor. ونشيل طبعا هنا البنكرياس head of the pancreas ونشيل الديودينم ونسوي triple bypass as palliative treatment or ERCP stenting for those with head of pancreas that cannot be removed completely, cannot be resected completely. That's why we should do a palliative bypass for them by suturing the common bile duct to the gallbladder to the jejunum and the stomach to the jejunum and the jejunum to the jejunum. يسموه تربل بايباس. احنا عندنا 3 انواع من الربط راح نسوي، نربط المراره بالججنم ونربط بعدين الججنم للججنم حتى نمنع الاوبستراكشن لانه راح يصير كينج بالجوجنم، وبعدين نربط الستومك بالجوجنم لانه التيومر اذا كان بالهيد اوف ذا بانكيلاس راح يصير head of the pancreas large, it will obstruct the duodenum. فالمريض يصير عنده repeated vomiting. فلهذا دي قدام نسوي لهم gastrojejunostomy. Biliary structure either by stenting or choledochojejunostomy by Rho and Y hepatojejunostomy. Classic tumor طبعا radical resection or palliative stenting. Biliary atresia اللي هو كازاي اوبريشن يعني hepatojejunostomy نسوي لهم مثل ما حكينا لكم بالمحاضرة الثانية choledochal excision or hepatojejunostomy. For the pruritus اللي قلنا due to bile salt deposition and histamine release ممكن نعطيهم anti histamines أو نعطيهم cholestyramines أو نعطيهم rifampicin as treatment for symptomatic treatment for the pruritus. شكرا جزيلا. هنا قبل ما نخلص اكو بعض الصور على how to do PTC. This is a PTC ده تلاحظون صورة diagram هذا for the PTC. It's a diagram الليفر وهذا biliary tree dilated. هذا ERCP diagram for the ERCP ده تلاحظون شلون فايتين من الاسفنكتر of audio to the lower end of the common bile duct. هذا common hepatic common bile duct. هذا ERCP وشفنا الستون persistent area in the lower end of the common bile duct due to multiple stones. فاسيتد ستون تلاحظون common bile duct مليان حصوات هنا بالcommon bile duct. طبعا هذا الترا ساوند نشوف الستون موجود هنا بالcommon gall bladder. هذا acoustic shadow behind it. قلنا دائما اكو ظلال بالظلال واضحة. نعم هاي التايب اوف ذا سيرجري اللي هو تريبل بايباس سيرجري. شكرا جزيلا.